5 principles of a trauma-informed approach. Trustworthiness. As we find ourselves still coping with the pandemic, the principles of trauma-informed care can be used to develop our organizations in ways that empower workers to better support quality of life for residents and clients. Trustworthiness is one of the 5 principles of a trauma-informed approach. The principle of trustworthiness is clarity from support people, consistency, and follow-through. As we continue to navigate through the collective trauma of the COVID-19 pandemic, trust has been tested in many ways. Initially, we lost trust in what we all knew as a way of life. Also, in the workplace, we often were not able to trust the systems that were in place. Workplaces have an opportunity to repair trust and lift up trustworthiness as a core value moving forward. During the pandemic, many direct care workers had their trust tested in their daily work. They were asked to put trust in organizations that couldn't always follow through with plans around safety, work schedules, coverage, or clear practice guidelines. With everyone stretched thin and stress levels high, it wasn't always possible to communicate effectively, which in turn undermined trust. Care organizations can work to rebuild or establish trustworthiness in multiple ways. One opportunity to easily build trustworthiness is to host learning circles for staff and residents. Learning circles bring together a group of people to share information, build relationships, and solve problems. To host learning circles, identify a facilitator. If the facilitator is within the organization, be mindful of power dynamics. The next step is to develop a short list of questions for the sessions that can be shared ahead of time. The first question should be fun and easy. For example, what is your favorite vacation spot? Everyone in the circle has a chance to speak or pass to the next person. This can be assisted by having some sort of talking object to pass around the circle. This supports the idea that only the person who has the object can talk. Remind participants that crosstalk is not allowed. At the beginning, host multiple circles to address power dynamics. For example, host a separate circle for managers, administrators, frontline workers, residents, or other groups. After trust and relationships are strengthened, it will be easier to have learning circles that are integrated across positions. Hosting multiple sessions also ensures that people from all shifts can join easily. Allow people to use work time to attend sessions to make sure that everyone can participate if they want. Some possible trust-building learning circle questions include: what is going well in your work environment? What are some challenges you're experiencing in your work? If you could change one practice in your organization, what would it be? How would it change? What would be some team building activities that would be meaningful to you? Once the sessions are complete, make sure to summarize themes from the sessions. Do not share identifying information from the themes, and instead share overall feelings or recommendations. For example, share: workers express the importance of carving out time for team building, not the managers in Vanessa's department don't communicate well. Organizational leadership should then review themes and develop plans for addressing concerns and enhancing what's working well. The plan should include accountability measures for the organization. Following through on the priority action items after learning circles is a critical step to building trustworthiness. If there is feedback the organization cannot or chooses not to address, this should be communicated as well. Plans should be communicated across the organization to all levels of the workforce and residents as appropriate. The communication should include the accountability measures. The organization should have regular communication with members of the organization about the progress on the accountability measures, and members of the organization should be able to check in on progress. Clearly defined communication plans will aid this process. Trustworthiness is built when workers and residents can experience organizational buy-in and see progress related to their feedback. Follow-through and consistency are a critical component of building trustworthiness. Trustworthiness increases quality of work and employee and resident well-being. Trustworthiness also contributes to retention. With trustworthiness, each member of the community feels the organization truly understands and responds to identified needs. What will you do to increase the principle of trustworthiness in your organization?